Okay, so I'm here with Melanie Toarmina Pang, graduate of the Graduate College of Social Work and working now with the Houston Food Bank. But Melanie, I'll turn it over to you because I'd like you to tell us just a little bit. First, thank you for being here. I appreciate your time.
Oh, of course.
And I thought, could you just tell us a little bit about you, when you graduated from the GCSW and what your role with the food bank is?
Sure. So thank you, Alan, for inviting me to be a part of this project. My title is Government Relations Officer, but as you'll probably find out from this conversation, there's a whole lot more that social workers tend to be called to do. I graduated from the University of Houston first in 2010 with my undergrad degree in journalism and a minor in GLBT studies, and then went on to get my master's in social work at the University of Houston and graduated in 2012. I've, have since done case management and data and program evaluation, as well as did a little bit of teaching, thanks to an invitation by a certain dean, and have found myself back in the realm of services and specifically in the realm of basic needs.
So on a regular day or a day prior to the pandemic, what was your job?
Probably a regular day, a typical day in the life of government relations is kind of hard to pin down, but I would definitely say that we were doing a lot of planning around promoting the census. We were trying to find different ways because of the population we serve, which typically is low income, working, and families, and seniors. These are typically hard to count populations, and so we were trying to find ways to integrate more civic engagement, integrate census promotion, talking more about how food insecurity is actually just a symptom of poverty, and do more education around all of that. And so it was a lot more, long-term planning in the midst of relationship building with elected officials, trying to get them to be familiar with our issues, and to let them know that any policy that would help people experiencing poverty would help anyone who's experiencing hunger too. So a regular day was certainly not at this pace. I would say it was certainly like something that was done at my own pace, really. I could determine, how quickly or how slowly a project was going to move. And when you're in the midst of disaster, oftentimes government relations, you end up putting on more of a rapid action hat than a planning role.
So what's happening at the food bank right now, and how is food being distributed, and how are the people that are doing the distribution, how are they being protected?
Wow. So our operations, I think all of us had been prepared for another Hurricane Harvey, but we were not anticipating that we would have to be serving as many people as we're serving right now, and in the way that we're having to serve them. So I would say that on a typical day in our volunteer operations at our warehouse, we might have anywhere between 300 to 1,000 people in that carousel room. Well, because of social distancing and because people should be staying home, our volunteer numbers have dropped to about 100 a day. And if you have, and this is related because if you don't have the volunteers to sort and pack the food can't get out the door. And so we are having to find, additional workers, folks who'll be able to step up. And part of that is collaborating with the county to see if we can get additional funding to hire on those temporary workers. So that's where I am involved in that. How we're distributing food right now is through our pantry network. So, we have about, I would say 600 or so active partners all across our 18 county region. So all the way up to Trinity County, all the way down to Galveston. And we operate through them. So we try to pump food to our pantry network, and then people can go to a place that's closer to their home rather than having to drive all the way to the food bank. Now, the challenge with that, as you can imagine, is that you don't want hundreds and hundreds of people lining up or being in a crowd together. And so we had to equip our partner agency very quickly with new volunteer procedures. So our volunteers have to have food grade gloves, they have to have hand sanitizer, they have to have a hand washing station, they have to have a trash receptacle, and they have to be 6 feet apart from each other at all times. This is extremely challenging to, ramp up 600 pantries to be on the same procedures and guidelines. But once we kind of stated that, Harris County judge has told us if she sees any more B-roll footage on the news of people handing things to each other very closely, she's going to shut you down. And so, we understand that we're trying our best not to create, to add to the spread of this virus, but we also understand that we're having to juggle, people's need for food. And so for our seniors and folks who can't even get out the door, we're doing direct deliveries.
Okay.
And this is like trying to ramp up. It's like trying to have a startup company within your nonprofit and to be on a timeline of, distributing food as soon as possible. And so we are able to do at this time a limited amount of senior direct deliveries, but in the next few months, basically our senior box program that feeds about 21,000 seniors across the city and county, we're going to have to change all of that to direct delivery. So that looks like about 400 delivery stops a day. So we're having to recruit volunteers. We're working with a nonprofit called Crowdsource Rescue, which used to deploy boats during Hurricane Harvey, but is now deploying volunteers to pick up food from nearby pantries and take them to people's doorsteps. So we're trying to scale up that operation to be able to help with deliveries to seniors and other vulnerable populations.
So what are you hearing from the field or seeing? What are your clients experiencing? What do they know about the virus? What do they know about how to protect themselves? Particularly the really vulnerable people and the seniors, like you talked about.
Well, I would say right now, we're about, 3 weeks into our disaster operation, and the fear is still at a very high level. People are still very nervous about going outside their doors, but they're also nervous about even the packaging, right? The packaging of the food. And, our recommendation is, once you take things out of the box, throw away the box, wash your hands, take the stuff out of the packaging, wash your hands after that. Like, there's a lot of precautionary things that we're trying to do that, where we are right now is that we just have to treat everything and everyone like they might have it. And so it's not about necessarily like, how can I stop myself from being around the virus at all? It's more about how can I minimize as much of the possibility that I might touch my face or that I might, eat with my hands or whatever it is. But, it's been interesting to watch this play out in the community. I think in the beginning, there was certainly a much higher level of anxiety. And when people were panic buying at the grocery stores, I think that made people think that they were going to need to panic stock up on pantry foods as well. And so the crowd control at some of our distributions was extremely difficult. We actually got a stern talking to about that and the possibility of having to shut down because of how rowdy the crowds were getting and how close together people were. So I had to make this difficult decision about, well, do we bring in law enforcement to help us manage the crowds, or is that going to make people afraid to pick up food? And, having to weigh that is not something any social worker would want to do, but at the same time, if we shut down, that means no one gets the food. And so we've had to actually leverage the police department, Harris County Sheriff's Department as well. And they've been really great about at least keeping distancing, even just using their own vehicles or their cars or cones, things of that nature, so that there are fewer bodies and just more regulations. I think that also people are experiencing a lot of anxiety, not just because of the virus, but because of their work situations, right? So people who are already on low wages, already working for tips, might even be a part of these things that are considered luxury, right? And there aren't as many people buying those things. And so, a lot of people feel this calling to, eat out more if they have the money to do so, to try to keep these businesses alive. And I think that heightened anxiety about what's going to happen to my job, what's going to happen if I go to the store and there's nothing there, has really made people think, okay, I need to utilize every resource that's out there.
Sometimes when we have a crisis like this, I think we saw it in Harvey and we're seeing it now. When you have these crisis situations, they tend to shine a light on some of the bigger inequities that we face in society. How are you seeing this play out with the pandemic?
Yeah, when we were trying to brainstorm with HISD how we were going to serve their families, we were able to come up with, this sort of drive-through method, right, where people would just pop their trunk and we put the box of food in and they could drive off. Well, for families whose kids are on free or reduced lunch, they don't all necessarily have transportation. So are they going, if the site is 3 miles away, they are not going to be able to walk with their children 3 miles to go pick up food and bring it back home on foot. And so I think that, there are a lot of things that are still in the works. But some of the other things I think about are, people who are experiencing homelessness, if they were to contract the virus, where do they quarantine?
Right.
Where do they heal? And then I also think about our own workers. So people who are hourly workers who are in our warehouse are the ones who are having to, break their backs trying to get food out to the community. And then that makes me think about grocery store workers and the gig economy of, all of these folks who were getting paid basically as little as possible by some of these companies are now the very people that we're relying on for food, for basic necessities. So all of these advocates and efforts around, raising wages or hazard pay or things of that nature are not absurd. They're exactly how, they're the opening for wealth redistribution and reallocation, right? To be able to say that the people who are at the top of the industry are not exactly who we are relying on. We're relying on the everyday worker. And so I think this is actually a great opportunity to be kind of flipping that model and kind of showing people just how essential everyday workers really are, and hopefully creating some equity there.
Right. That's something you brought up, the word opportunity. It's something that I've been trying to think through a lot. What are the opportunities in a crisis like this that we could learn from? And I'm really thinking, this idea of expanding our moral imagination in a time of a crisis. If you think about moving forward, when we're post-pandemic, what are some things that you'd like to see us to start thinking differently as a society, to treat each other better, to really think about some of these inequities and how we could prevent them from existing in the first place?
One bright spot in this that I saw recently was that Harris County has been doing a really good job, according to phone location data, of staying apart from each other. Got an A on that report card. And so that gives me hope that people are actually thinking about the collective whole. When you're talking about expanding the moral imagination, that is totally what I'm here for. I love trying to integrate that into everything that I do. And I think just this has created such a window into how what I do is clearly affecting everyone around me, right? I may not know whether or not I have this virus. And so my behavior is actually going to directly impact the people that I see every day. I mean, what an obvious metaphor for how we could be thinking about everyday life. Whether it's I'm using these throwaway disposable plastics every day and it's going to have this massive impact on everybody, or I'm burning all this fuel when I could be doing carpooling or taking public transit. I guess there's just so many different ways to look at what my everyday actions are doing, and how the ripple effect is going to impact everybody else in the world. One of the big opportunities that I see definitely is that there's a lot of government assistance going on right now. And it doesn't have to be assistance. It could just be the way that governments operate, right? The way that our government and our economy are structured need to shift in ways that truly protect and support the very baseline of our sustainability as a society. And I think for so long we thought of the economy as a thing that is separate from us, but actually we have so much more power and control in it than we think we do. And when it comes to the government, I think it's becoming more and more apparent that we ought to have more power and control than we actually do. And so I think it's really a good opportunity to be showing which individuals or which offices of elected officials are actually doing things for the community, and highlighting the ways that people are voting on things like the CARES Act or voting on the Family First Coronavirus Act, right? And then reminding them when all of this is over, remember how much that did for our economy. Remember how much that did for people's, ability to get out of this.
Right, right.
And I think that the more we can be tying that policy and more of that collective whole idea to everyday life, the better off we'll all be.
Yeah. Wow, that's profound. Just the idea that you said about not thinking about it as assistance, but thinking about it just as the way our government works to help people and support families. I hope that's the way we can start to think about us as a society and who we are. Wow, thanks, Mel. Last thing I want to ask is just how can we help? How can people help? While I think a lot of people have struggled in this, they want to be out there and they want to be helping. And when we had the situation with Harvey, people were out there and they were helping. But now we're all kind of faced with wanting to protect ourselves and our families. What are things that people can do to help?
Definitely, we need people power and we need produce power. So whenever you're donating money to us, we are figuring out ways to get more food in the door. So because this hasn't been declared a national disaster yet, food is not flowing to us like it was during Harvey. We are having to actually purchase it, we are having to procure it, and then we are waiting for those trucks to come in. And so that's one of the ways that we're using your donations. The people power element is really interesting because it's changing, right? We don't necessarily want you to come to our warehouse and pack a box because we need to keep people apart from each other and all of that. We have workers to do that now. And so what we're really looking for are folks who might have their own transportation, who would be willing to drop off the box at someone's doorstep. This is also interesting, Alan, because I think it also brings up the expanding the moral imagination about what service can look like.
Mm-hmm.
And when you do this project, you're not going to get to see the smiling face of the person on the other side of the door. You're not going to maybe get to hear a thank you or get the gratitude that would fill your cup. You just need to know for you that you've done the most you can do, and do what you need, your own personal work, to feel like that's enough, because actually if they were to open your door, they would be putting you at risk, or you would be putting them at risk. And so it's really interesting how like our ideas of politeness need to shift, how our ideas of compassion need to shift, that this isn't just something that's supposed to serve both of us, it's literally just supposed to serve them. We don't need to create a lot of win-wins, we just need to create wins for people who haven't had them in a long time, if at all.
Well, thank you again for doing this. I know that your life has been completely turned upside down in the last couple of weeks, and I really appreciate everything that you do, Mel. I'm just so proud of you as an alum of our program and so grateful for all you do. And I really appreciate you taking the time to chat with me today.
Thank you. Thank you for that great diploma back there. I'm very, very proud to be a part of this profession, and very grateful for anyone who's wanting to do anything at this time. I know it's a lot to even just to take care of yourself. So, first and foremost, doing that will do a lot for the world. So.
Thank you, Mel.
Thank you.
Thanks.